Yes, my friends, welcome again. Thank you for choosing our clinic. You are 27 years old, right?
28 now.
28 now. You are single. How
Yes.
do you understand you had a varicocele disease?
Maybe 4 or 5 years ago,
Yeah.
I had some pains.
Yeah.
In that time, I used to go to gym and
Yeah.
put a lot of weight and doing squats and so on. And I went to the doctor, and they said that I had varicocele. But
with the physical examination, they find out, right?
yes, with Doppler and by touching.
Okay.
And I didn't treat it in that time because I didn't want, but now that I want to preserve the fertility and in future make.
How is the pain? Is it still continuing?
Very little.
Okay.
After 4 days, or you talk now, before the surgery, or
before the surgery? Yes. By the years, so you came here, so you had a problem.
Yes.
And this was pain.
Yes,
it was always in your mind, right?
Yes, it was most of the time like discomfort in the left testicle, little bit heavy, and occasionally I had like a sharp pain. If I stay too much long time, I used to like sharp, like a needle or something like that, and I knew that this is because of the varicocele. And sometimes I used to see the veins on the left side.
Yes.
If the testicles hang down, I see those bigger veins.
Yeah, I want to a little talk about this because it has always too much concern when people see the veins. They are expecting, of course, I will remove all the veins and they will see nothing. This is not the case all of the time because there are two types of veins. One is external, actually three types of veins. Gubernacular veins are far behind at lower part of the testicle, and they are easy to disappear. External vein, it's located around the testis, it's far away from arteries, and it is very easy to remove it. So we remove the external vein. Sometimes people have only large external vein, and after the procedure they are 100% happy. Sometimes people have large external vein and large internal veins. At that time I remove the external vein long, but for the internal veins, at the inguinal area we make a large dissection, but it has continuation and it is divided into branches. So people may see these branches for a couple of months, and sometimes they become too much anxious about it. They say, why still we see veins although you removed large veins? So it's possible. Sometimes there is no external vein, all the large veins are internal. So at that time I remove the upper part of the internal vein, but at the lower part there are a lot of veins remaining after the procedure, but they are disappearing in a couple of months. So in your case, there's not too much remaining veins, but still you will see some of them when you touch palpate. But they will disappear in a couple of months easily, because I know in the upper part I removed and I checked now they are finished in the upper part, but around testis there are some veins, they will disappear by time. What do you think about the post-operative recovery period? Is it easy or is it?
It's easy, yes. 90% is not.
You come by yourself, you have no accompanying person with you?
No.
Yeah,
yes,
is
alone.
The problem?
No, it's very easy.
Yeah.
It's very easy. Okay. Pain, it's day by day is going away.
First day is
First day is little bit pain, and now after 4 days, I don't know if I make some quick movement, if I very quickly wake up from the chair.
You have to be very careful.
Yes.
And other than this, you will now, in the recovery time, for 1 month, be extremely careful.
Yes.
After 1 month, it's more easy, but still, I don't want any trainings, weightlifting, such things for 4 months. After 4 months, everything will be settled, and you can send me a Doppler ultrasonography and a sperm count at that time.
Okay.
This is all what we do, and we use some supplements, medications to increase the sperm count better, fastly, quickly. Other than that, try to live, relax and slow. for a month. Be very careful, and we will be in touch. Thank you for coming. Thank you for
Doctor.
sharing your ideas with us. Thank you.
And,
Do you have any questions?
Yes, you said about prostatitis.
Yeah, okay.
After the surgery.
Yes, we always check for this, and because the reason for testis pain is varicocele mainly, but sometimes prostatitis also cause this pain. So in your case, we emptied the prostate and we find a little more than we expected. The fluid was more.
Mm-hmm.
We cleaned it now. In 50% of the patients, it will never come back again. In 50%, they can feel after a couple of months some testis pain. And of course they will think, oh, testis pain is back, so it may be varicocele recurrence.
Mm-hmm. Mm-hmm.
When they do the Doppler, if there is no varicocele recurrence, no vein, that means prostate is filling again.
Mm-hmm.
So you have to empty it again. I've shown a video how to empty it yourself. You can do a self-prostate massage. If you can't do it, there are massage devices. If you can't use them, we want you to come back for 5 days. We will do everyday prostate massage and we will clean it. It cures maybe 90% of the patients. A 10% will have a recurrence in the future one more time.
Yes, yes.
So it may happen a couple of times, but we teach you how to do it yourself, how to do it with massage device. So I hope there will be no recurrence. If the recurrence happens, I hope you can cure it yourself. We will be in touch and we'll speak about this.
Thank you so much.
Yeah, thank you very much. Thank you. Have a nice day.
Thank you, sir.
Bye.
Thank you.